You can get injuries around the elbow. You have a tennis elbow, golfer's elbow. Go down around the hip. You can get stress fractures, common in females. You can get injuries to muscles like the piriformis syndrome, get muscle strains. Around the hip anteriorly, a common injury is the groin pain, groin injury. We go down lower, you get to the thighs, you can get hamstring injuries, pulled hamstring, pulled quadriceps. Around the knee, common injuries are injuries to the ligaments within the knee. You've got your ACL. You know, a lot of you know about the ACL, cruciate ligaments. Sometimes you get the PCL and what are called the collateral ligaments. Lower down into the legs, shin splints are very common. Around the ankle, you can get ankle injuries. You can get injuries to the Achilles tendon, sprain, a strain, or a rupture. And within the foot, and the stress fractures, and another common condition is plantar fasciitis. So for management of injury, we break it down into different areas. There's immediate care, there's rest, there's rehabilitation. Mentioned the access to medical aid, cover hospital and physiotherapy facilities. There is rehabilitation. And then you have to have proper return to play protocols, which are dependent on the sport. So in terms of immediate care, as we can see there, we all remember this from the Euro 2020, when a player collapsed on the pitch and was saved because of the immediate response to injury. It was good. Preferably, immediate care should be done by a medic, and that is why we really encourage that all sports should have medical personnel on site. The reason for this is, one, they can do immediate care. They can do what's called resuscitation in case an athlete collapses, and the main end goal of that is saving a life. Now, in terms of immediate care, for us, what we want to do is prevent further injury, aggravation of this injury. And we'd like to encourage coaches to do these basic immediate care in sport injury courses. The different sports have got different modules which are online. And you may also be able to go to such emergency response providers such as Red Cross, one ambulance, and do a basic first aid course. So down there's immediate care. Dr. ABC, that's for example, a collapsed patient, a patient who's been knocked to the head, all. Then for soft tissues, we do what's called price with no harm. I shall explain them in a bit. And the end goal is for you to stabilize a patient and to refer. So for Dr. ABC, DRABC, what it stands for is assess the athlete for danger, whether it's safe for you to approach the athlete. That's for you and for the athlete. Because remember, if an athlete is down on the ground, you run onto the field and it's not safe for you, you can also get knocked, say in a contact sport, an energy sport. The response is you're checking if this athlete is awake or not awake. So you're shaking them or calling out their name to find out if they're awake or not awake. And at that moment, you're also shouting for help. So you're trying to check if there's a response from the athlete, and you also shout for help. And then the ABC is just I'm checking for airway, for breathing, and for circulation. These are a bit more complex, and these are what I was mentioning as encouraging you to take these basic courses in first aid. In terms of soft tissue injury, PRICE is the mnemonic we use when we're coming to when we manage acute soft tissue injuries. So protect just means you're protecting it from further harm. So for example, say it's a fracture, you splint it. If it's soft tissue injury, you cover it, you keep it clean as you refer, and then you rest, ice, compress, and elevate. Okay? And by saying do no further harm, you should avoid heat. You know, a lot of times we find athletes on the field and we may not have a medic, and what a coach has is a can of deep heat. And you go and spray deep heat. We're avoiding heat. You avoid alcohol. You tell your athletes not to take alcohol. Avoid further activity, so no running. Avoid such procedures as massage. So do no more harm to the athlete. In terms of management, access to medical aid cover on hospital. Now, the reason for that is now when we're doing definitive management for an acute injury that requires such a management as surgery, we need to have these with us. So treatment of some of our acute, say you have a fracture, you need to go and have surgery, you've got tear of a muscle, can get tear of a tendon, of a ligament, and you need to go in for surgery. Medical aid, which is insurance, access to a hospital is very, very important. And then after surgery, what we have is called rehabilitation. Now, rehabilitation, the key to rehabilitation is physiotherapy and physical therapists, okay? Now, they're very, very important when it comes to sports, because if you don't do your physiotherapy well, you can heal, but you may not be able to heal. You may not heal and be able to perform to where you were before, or you may not heal and be able to even take part in sports. And as you're doing that rehabilitation with the physiotherapist, then now you start following, and it's sport specific. And you start following a proper what's called return to play protocol, so that you gradually get your athletes to get back to from point 0 where they're at injury to point 100 where they were performing before the injury. In terms of injury prevention, there's a wide scope when it comes to injury prevention. It's a whole discussion on its own, but just to touch, we have tools such as the Van Mechelen, the TWIP models. And what these models do describe is basically it's a stepwise model which goes through establishing the extent of what the injury problem is. So this you do by looking at the incident and the severity of the injury. Look at the number. So you're looking at how many of your athletes have these injuries, how severe are these injuries. And after that, then you're looking at establishing the cause and mechanism of these injuries. Once you have done that, then you introduce preventive measures. And then you reassess just a stepwise manner. Gotten the extent of the injury problem, you've gotten the cause, the etiology and mechanism of this injury. So you've come up with preventive measures, and then you go back and reassess by going back to initiating step 1, which was establishing the problem, and find out whether you've solved it or you've not. Now, other methods preventing injury, conditioning and neuromuscular training really assist. So you look at aerobic training, agility, strength, and balance. These are very key when you come into injury prevention. These are the key aspects of the pre-season training. Coaching technique. So exercise programs are very important when it comes to injury prevention. And again, as mentioned, they're very sport specific. So one of the things is that coaches need to widen their scope when it comes to education in their sports. There's a lot of coaching courses that go and you better yourself, so that we don't stick to the old systems and old modalities of coaching, and the trends in sport are increasing. Sorry, I can see your hand up when I'll go. John Gola, your hand is up.
Yeah, just wanted to let everybody to mute their gadgets, especially the lady on the screen. It's bringing a lot of interruptions. So kindly, if you're not speaking, mute your gadget. Thank you.
Another aspect of injury prevention we need to look into is equipment and training facilities, because you have to have the right equipment in terms of gear, in terms of shoe wear, in terms of what you're using to, yes, gear and shoe wear. And then the training facilities, you're looking at the turf, you're looking at whether it's grass, you're looking at the floor, if it's a gymnasium, you're looking at the track, in different facilities. You're looking at a ring, if you say it's boxing. And then also nutrition and hydration are also key in injury prevention. A small touch on nutritionists. Another of the areas that we highly overlook is nutrition. And it is encouraged that sports by sports teams need to contact nutritionists and have team visits by nutritionists. They don't necessarily have to stay with your team, But what they can do is they can give you, they can assess your players and give you plans, and they can give you sport-specific plans. These are will be targeted to your athlete needs, and they can give you dietary plans. They can give you different plans during different phases. So the phases can include, say, off-season, what they can be eating, and then pre-season when it's high intensity, and then when it's a maintenance phase, like in season, then they can give you a different nutritional plan. Okay. A thing to look at: recovery and supplementation. I know we're going to just touch briefly on doping supplementation, but there are some sports that with time we have come to realize that they require supplementation. What the diet alone is not enough. The key thing with supplementation is that supplementation is not encouraged, but when it has to be used, then you have to keep sport clean. So you need to know the supplements you're using, whether they're safe or unsafe. And you need to know that you're not using this supplementation to cheat, but just to supplement what you require in your sport, not to cheat. In terms of mental health, as I mentioned at the beginning, it is one of the most overlooked aspects in sports. And remember that an athlete is a human being, and their social, psychological, and emotional well-being are very, very important. And without this, then you cannot get an athlete to perform at their peak performance. Say an athlete is stressed, has got anxiety issues, depression, eating disorders are also part of mental health issues. They could have burnout, and we overlook it. You know, as coaches, you have to push an athlete to the limit, and they've got burnout. It affects their mental health, and they cannot remain in a state that they can perform well. So mental health is very key when it comes to athlete performance, and monitoring is very, very important. There are a few mental health specialists who are sports, who are interested in sports. And if any of you coaches would like to get in contact with them, we can share their contacts, and they can come and do assessments and assist with assessment. And in case you have high-risk individual, there's early recognition and management of these. In terms of monitoring, there are examples of tools that are used to monitor. For the Olympics team, and actually it's just for health for sports in particular, there's a mental health assessment tool, and there's a mental health recognition tool. And these are some of just the ways of monitoring and follow-up in mental health in sports. When it comes to doping and violations, supplementation has become a very, very interesting topic, because yes, there are those athletes that require to supplement their diet. There are those that use some of these supplements for recovery. What is important to note is that each athlete is responsible for what they take. Not the coach, not anybody else, but an athlete is responsible for what they take. So as a coach, if you're giving an athlete something, you're also responsible for it. Yes.
How come sometimes our athletes, they go out to compete without some of these injuries being noticed?
So when I shared, how come they compete without them being noticed?
How come our athletes, for example, they are going to Paris, okay?
Yes.
You will notice that some of them will go out and they in the national team, and they go out to compete without these injuries being noticed. What usually happens?
So to answer your question, what needs to be done at that juncture is, when you're going into camp, before you start a camp, for example, to leave for any competition, essentially you're supposed to have what's called medical profiling, which I mentioned as the first thing. Now, part of medical profiling includes injury profiling. So we've got tests that can be done by what's called the elite team. Now, elite team is a team that consists of strength and conditioning coaches and the sports scientists. They've got tests that can test and find out whether a person has an injury or not, and if they're fit to participate in sport. So essentially, we can't talk about the past here, but talking about what is essential is that we require to have injury profiling done as part of your player profiling. So it's not just medical conditions, but also you want to look at the injury profile of this athlete. So each and every athlete undergoes a test. And now with these tests, you can pick out, say, for example, somebody has a quad injury. There's a test you can do to test and say this person has a quad injury. And as they're doing that, they will fail the test if you cannot hide that injury. Yeah. So as you plan for games, as you plan to compete, and even as coaches, I'd encourage you to have player profiling done, and that includes injury profiling. Thank you.
Thanks, Victor. Any other person?
There's Bernard Oma. Can see Bernard Oma.
Yeah, thanks, Dr. For the wonderful presentation. Mine isn't a question per se, but an area of concern. My name is Bernard Oma, and I'm an athletics coach with Athletics Kenya, and the founder and the head coach of Rongai Athletics Club.
Yes.
And in my stable, we got some elite athletes to Olympic level and several world champions. And this is touching on the area of doping violations. The AB, the athlete biological passport. It's just a concern as well. Maybe I can pass it over to you as well. They're having a longitudinal sort of approach to this by setting a reference and a baseline to checking the parameters on the measurement. But if you look at some of the athletes, more so the Africans who are coming from the high altitude areas, there's an environmental effect to these biological passports, unlike those who are training at a very low level. And you find most of the penalties are based on hypotheses. And then you're being put to prove to this. And if you read a lot of literatures, there are a lot of gaps into the literature review as per the biological passport of many athletes. As a medical physician in sports, and you're heading to Paris 2024 as the head of the medical team, in the future, is this an area you guys are planning to do something to protect the clean athlete, maybe at some point wrongly accused of manipulating their biological passports? Or what are you guys going to do about it in terms of research and closing those gaps?
Thank you, Coach. So what's happening currently is we're having, there's a lot of research going on around the anti-doping and the biological passport. 6 months before the start of the games, we're going to have seminars with the International Olympic Committee, athletes, coaches, and the entire athlete handlers to discuss the findings from these, so that by the time we're going into competition, there are no issues. And those are some of the issues that have been raised and are being discussed. So we shall invite you for that and the athletes, and we shall give an update on that. Thanks.
Thank you very much, Dr.
I can see Harrison Kaudia.
Yeah, my name is Harrison Kaudia. I'm from All One Basketball, majorly in player development from grassroots to elite level. So what I've noticed about the role of the coach is even at the national level, the coach is made to assume all these roles that we have talked about: nutrition, injury prevention, SNC, and I only see the establishment of a performance team at the Olympics level. So I don't know, is it possible to just lay down a policy that wherever there is a national team at all levels, even at the age grade level of the youth, the coach basically can only be activated once a performance team is established, which is a multidisciplinary team. So the coach is not still the one to run on court to attend to players' injuries and things like that. Yeah, the coach can have the basic knowledge, but there's somebody who is specialized in that. Because I've the national team for ladies, and that was my experience. There were players who needed athletic trainer, players who needed a physio on site. There was a physio. There are players who need this kind of assessment, but it was just the coach, head coach, and the assistant coaches, and then the physio. So I don't know how do we go about that.
Thank you, Harrison, for your question, and it's going to be answered in two parts. I'll throw John Ogola under the bus because he's one of the big people in sports. But in terms of what you're doing, first of all, we really appreciate coaches who work with the grassroots levels. Whoever works with the youth, whoever works with children, because you're instilling that is the basis and genesis of sport. It's much easier to coach somebody much younger. It's more difficult, but much easier than coaching an experienced person. And what you're doing with the youth is very commendable. Now, in terms of the medical aspect, we're really pushing, and through the National Olympic Committee, hopefully with the Ministry of Sport, with the Sports Ministry, we're trying to get enough medics on board. Like what we have done now is we're getting what's called a long list of medics. And once we get a long list of enough medics who are interested in sports, then now we can send them out to different federations, because we know there's the challenge of federations acquiring medics because of it's a cost. It's a cost that a lot of budgets that different federations have, they don't factor in the medical aspect, which they need to. So we want to find medics who are interested in sports, who we can tell that go to this federation, assist this federation. They may facilitate a little bit here and there, okay? It might not be your primary job, but you can go and assist them. And that way you can try and push this narrative of player welfare across board, even to that grassroots level, even to different federations. But I can tell you that a lot of federations, I know we've been doing we've been getting our database, and a lot of federations do not have medics. And even if they have, they don't have enough. Say like basketball, you'll have a doctor, but one doctor cannot cover from the senior team 5v5, 5x5, 3x3 to the junior ones, to the grassroots. One person cannot do that. So we're trying to get as many people on board to go and cut across board so that we provide better player welfare. And that goes for all aspects, even the coaching, even the elite team. But I think Bwana John can also give you can answer.
Yeah, thank you, Dr. Harrison. Your concern is very valid. It's something that we are aware of. And 2 weeks ago, we launched a program with the University of Nairobi just to help on the basics of coaching. So every coach should be required to undergo a specific training, specific certification graded for them to be able to work with the national teams. So it's something that as a National Olympic Committee, we are alive to, and we've come up with ways to try and mitigate this. We are working with other coaches too, like such forums, just to ensure that every coach is educated. Every coach has the basics and the basics or the science that they need to, backed with their experience, that they need to be able to conduct their jobs well. Thank you for bringing that up. I hope that answered you.
So we have Paul Odera.
Thank you.
Welcome.
Yes, Dr. Good afternoon.
Good afternoon, Paulo.
Yeah, it's nice seeing you here. This is a fantastic opportunity, I think, for us coaches to hear about sports science. So mine was both a contribution and then a question. I think when I had Zit Harrison contributing a few minutes ago, and I can remember from my experience coaching a national team, where at that time it was the team manager and myself, and then it developed into a team manager, myself, and physio, and then it went into team manager, myself, physio, and as conditioning coach. Then went into team manager, conditioning coach, myself, and medic, chief medical officer, and it's built that way. So it's a very good question. I think for me, I'd just like to share that you've got to then become a student of pretty much the high performance program, because if your federation cannot afford a strength and conditioning coach, then read about it, become educated in it. You may not be the expert in it, but as the head coach, then it's paramount that you have the information there, and then do as much as you can around medical. So that's my advice I'd give those coaches who are coaching at elite level, and at the moment there is no capacity to give them a high performance team. My question, Dr. is around anti-doping. I'm working with some coaches, and their question was they needed support around anti-doping. What would be the best way to now start developing a program there? Is there a site we can go to first that the players and coaches can fill in a questionnaire and get a certificate or get educated? And then once we've done that as a base, then what's the next step? Or do we just get the whichever sport that is to write to ADAC to get them in, or do we all go over to ADAC, or how can it be done in terms of developing an anti-doping program for an elite team here?
Good, thank you, Polo, and I'll echo your sentiments, and the aspect of pushing as a coach for an elite team is key as a coach, and you approach your federation and you tell them that, look, I need to have an elite team for elite performance, because you see you need your athlete at their optimum or rather the performance for you to get results, for you to coach them and to get results. So I'll echo your sentiments again. But in terms of education, so World Anti-Doping Agency have got their website. They've got something called ADEL, ADEL, Anti-Doping Education and Learning. It's a platform on the WADA, and I'll just send it on the group called ADL. I've shared it in the messages, and you can go online and get your certification. They've got quite a lot of material for learning online. So you can do that, and you can encourage them, your co-coaches, yourself, to do it. And I always say you can do it over and over again, because remember, learning is a continuous process. So by virtue of getting a certification this year does not mean that nothing has changed between now and next year. So you can keep doing it. And then second is you can approach Anti-Doping Association of Kenya. They are actually ready and willing to come and teach. One of their mandates is to teach about violation, doping and violation. So they have a department for education which goes around the country, and you can just approach them, and they should be willing and ready to give you that information. Thank you. Victor, I can see your comment about a sports scientist and technical team for fitness testing. Yes, that is what I had mentioned earlier, but maybe you have another question. I see your hand is up, Victor Ashiali.
Yes, I wanted to comment on doping. I work with the Anti-Doping Agency of Kenya.
Yes, thank you, yes.
Yes, I wanted to reply on athlete biological passport. Now, what happens is that once you are identified as, once you are put in the RTP, the register testing pool, there are some tests that you are supposed to undergo as an athlete, mandatory tests, just to check your blood profile. Now, if we check at the baseline and identify that maybe your blood profile is at this level, take it another time, we find that it has deviated a little bit. And now next time we take another sample, we find that it has short. Then that raises some questions. Why was it like this at this time? And why has it short? all of a sudden. So it raises a lot of questions. Maybe we are talking about hemoglobin levels. And then you find all of a sudden the hemoglobin levels are really short. So that raises a question to this athletes, and that this has to answer why there's a variation in the blood profile that we are checking. In terms of anti-doping education, as a federation, you can always request the agency, and we always come. Like for example, we are already rolling out a program for AK from next week. We'll be meeting all coaches so that we can educate them on anti-doping issues, and they can also disseminate to their coaches. I think that's what I wanted to respond. And then also before I finish,
Yes.
the reason why it is important for us to educate is because for those who are going to Paris, at least there is a mandatory 3 tests that an athlete is supposed to undergo. So before we test this athlete, it is our mandate to ensure that this athlete is educated first before he undergoes the mandatory test. Somebody is talking.
Also, you have the
Someone is talking.
break.
Someone is talking.
What is it? Yes.
Eric, kindly mute your phone. Whoever is not on the floor, kindly mute so that we can clearly hear those who are talking to the group. Thank you.
So what I was saying is that the athletes have to undergo the mandatory education session, and as coaches, let us make sure that we give a forum to athletes to receive this education, so that when they are tested, they don't say that they didn't know they were supposed to be tested. So let them undergo the education session so that when we come to test, they know the procedure of testing, and when they are found with a substance or not found, they are liable for it because they were educated. So we are running out a program for those who are going to Paris, and everybody will be educated and everybody will be tested, possible.
Thank you very much, Victor. And it's very encouraging to see different professionals in this forum and doing other things other than your work as an anti-doping officer and coaching, which is very good. And thank you for that insight. Now, I'm seeing in the chat, there's Harrison Kaudia asked, what is prehabilitation versus rehabilitation? Prehabilitation basically is working with an athlete to I'll say improve their functional capacity, basically help them improve their functional capacity prior to surgery, so that post-surgery they can be able to deal with the effects of the surgery and get back to training quicker. Okay, so remember, post-operatively, a lot of athletes are inactive. So you do your prehabilitation. So you're working with, and I'll just break it down. You're working with, say, the muscles around the region you're going to do surgery, just to get them strengthened, so that post-surgery, you don't take a longer time to get back to full activity. Versus rehabilitation is where you're just taking care of whatever is injured and getting it back to full functionality. But prehab is normally done before surgery. Rehab is post-surgery or for those who are not going for surgery after rest. Thanks. Moto Williams, your comment? Yes, we shall have the recording, but I can also share with you the presentation. Moto Williams, yeah. So I'll contact you and I can share with you the presentation. Anybody else with a question or a comment?
I have a question.
Yes.
Oh, thank you so much. This is great information. I appreciate your time there for doing this. I have a question on the mental health regarding the assessment tools, the IOC assessment tools and recognition.
Yes.
Are they something that a coach can utilize, or would you recommend a mental health specialist to administer those? I'm not familiar with those at all.
Yes. So to answer your question, we don't have many mental health specialists in sports. They're not there. Mental health is quite overlooked. And a lot of what I encourage who I interact with in sports is that you can go and have a look at the tools. They're available online. You can have a look at a tool and you can see that these are some of the things that, some of the symptoms that present, say with this condition, with that condition, and they can help you tell, especially the recognition tool, it can help you tell whether an athlete is actually in a safe mental space or is not in a safe mental space. Yeah, so they're very simple to understand, something you can find online. Essentially, you'd require a mental health specialist to use it or a medic, but sometimes we don't have access to these professionals. We don't have access to them, and so I encourage you to just go online, look at the tool, and
Okay, thank you so much. Appreciate it.
so this, for example, is an example of the recognition
Okay.
tool. Yeah, there's an example of a recognition tool, and it just shows you like common experiences of mental health problems.
Hey.
Yeah, so you've got common recognition experience. You've got your red flags.
Snap.
And then what to do when these problems occur. And it's very simple. It's a basic recognition tool. It's one page.
Okay.
Yeah, and it's something I think we should strive to just have a look at. It's
That looks really good.
This one is sport mental health recognition tool.
Yeah, that looks like it might even be able to monitor overtraining as well.
Sorry, could somebody mute, please?
This is Michael. How are you, bro?
We haven't finished. Just a minute. Sorry, yeah. Kyle, you were talking. Kyle was still talking.
That test looks really good. It looks like something that might be able to be useful in monitoring overtraining, I think.
Yes.
Possibly. What do you think?
It does. Yeah. Burnout is a symptom of mental health issue.
Yeah. Thank you very much.
All right. Yes, Sarah Lynn.
Hello. Hello, bro.
Yes.
Hello.
Yes.
Yeah. How are we going to know? My question is that. My question I want to ask is that. How are we going to know the mental stage of the athletes in that area of mental problems or in the sport? How are we going to know the mental stage of the athletes? Either is it an elite athlete or a local athlete? How are we going to know? Please.
So, Mr. Michael John Abotsi, it's very difficult to know the mental health status of an athlete without interviewing. However, as I've just shared, and I've written on the group, there is that mental health recognition tool which you, as an athlete handler, can have a look at, and you can just by looking at that, there's red flags. You'll watch an athlete's behavior, and then you can approach them and ask them a few questions and see. So it's very difficult to know the mental status without being a mental health practitioner. Okay, but using the recognition tool, you can try and pick up one or two things and then refer your athlete and ask your athlete, possibly, could you go and get some help, or could you go and see somebody? Because remember, athlete performance, sometimes you can be coaching your athlete, and their performance starts dwindling and you cannot explain it. Okay, that's why we say mental health goes really unnoticed, that the performance just starts going down and you cannot explain why. Right? They don't do what they're doing anymore. They can't perform to their peak. So there's a lot of factors that come into play. stress, poor feeding. Those are all mental health disorders.
Thanks so much.
All right, Sarah Lynn, your hand is up. Sarah Lynn, maybe you've unmuted, yes? Okay, anybody else with a question before I hand over back to John? So I think for me, the most important thing as coaches is one, there's a few key aspects I'd like you to take home with you. The importance of teamwork, the importance of having a team and not being bearing the burden of the entire team. So a coach, your work is to coach. Your profession is a coach. So it would be important for you to get a team with you, get your conditioning coaches, get your nutritionists, get your mental health specialist, get your medics on board. Okay, try and at least get a physiotherapist on your team. Okay, and other than a physiotherapist, either get a nurse or a doctor on your team. It is very important. And number two, for player welfare, in case a player is injured, please do not force them to participate in sport. Do not say that this is your star athlete, that you have to participate, that they have to participate. Without them, your team is going to fail. No, because remember, they're not at their optimum. They will not give you anything, and you're making them worse. You're going to aggravate their injury. It's going to aggravate their injury, and they will not perform. So please, when you see an athlete is injured, ask them to get help. Ask them to encourage them to get their rehabilitation done to the end, so that they can perform very well. And finally, I would encourage you to do these courses on first aid, immediate care in sports. There's different sports have got them online, which is good. But if your particular federation does not have any medical courses online for coaches, then I'd encourage you to visit such facilities as Red Cross or St. John's Ambulance, just so that you can have the immediate care and first aid, especially in areas where you have a collapsed athlete, an athlete who's having a condition like asthma, such emergencies, so that at least, because we understand that a lot of the times you're the only ones left with the athletes on the training at training and during games. With that, thank you for your time, and I'll hand over to John Ogold. Thank you.
Thank you, Dr. Ondiege, and thank you for such a wonderful and informative presentation. We can only hope to get much more of this from you and other professionals. For coaches who created time to attend and participate in this discussion, thank you all again, and hope to see you again next time. We'll be sharing our next presenter, maybe the next 1 or 2 weeks. And of course, I have to apologize. This notice was very short, but it's good. We've realized about 33 participants, which is very good. And if you have any presenter or any information that you'd like to share with other coaches, you're welcome to share it. Otherwise, if there's any comment from any of the participants, and I would want to bring this meeting to an end. Anybody with a general comment? Probably go on.
I have something to say.
Yeah. Michael.
Yeah, yes, sir.
Yeah, go ahead.
So, yeah, I'm with this. Our doctor, I explained a lot. Unfortunately, I was busy in the training, but at the end of the day, I just quickly come in. And where I got in, I was so very impressed, because it's what is going on, especially in weightlifting sport. Most of the weightlifting federations does not even have requirement of the sport that So we don't even know how we can go through it. So if we can have type of this lecture and lesson, is going to help the individual coaches in their various careers in the sport. So I appreciate you, Mr. John. I appreciate Doctor for being around and with more help us. Thank you.
Thank you, Johnson. Daktari, as you've heard, people have really learned a lot from you, and just hoping to get more. Please, when you're ready with another topic, just let us know and we'll arrange for this kind of session again.
We shall. Thank you. We can actually break down this topic into the subtopics. So thank you all.
And thank you, Senior Coach Paul, for attending and giving more insights into these topics. Otherwise, thank you all and have a good evening. See you next time. Bye.
Bye.
Thank you, Gola. Bye-bye. Bye.
Bye-bye.
Thanks,
Bye-bye.
Secretary.
Goodbye, everyone.